Alaikum wa rahmatullahi wa barakatuhu. Welcome, students, beloved shuyukh, and honored guests. We are all gathered together to the most sacred month of Ramadan, and we have a very special guest today with us, Shaykh Abdur Raheem McCarthy, all the way from Ireland. And we would like to just each and every one of you the best Ramadan ever. Today on the show, we are going to talk about contemporary issues concerning what nullifies fasting. So this might be something of new fiqh that we all need to be aware of because it could impact one of us at any point in our lives, and it's also just good knowledge to be aware of in our deen, as fasting is obviously one of the 5 pillars of Islam. So we want to make sure that we do it in the most perfect way. So he's going to be helping us out with this today. As all of you know, Shaykh Abdur Raheem McCarthy is a very beloved sheikh that has international acclaim and has also graduated from the University of Medina. He did graduate from Usul ad-Din and studied Arabic language. He studied over in Sudan and Saudi Arabia for over 10 years. And he has also been on many national television programs. And he has also traveled all over the world to give lectures internationally. Without any further ado, we ask Shaykh Abdur Raheem McCarthy to go ahead and explain to us today about these contemporary nullifiers.
Bismillahir Rahmanir Rahim. Alhamdulillahi Rabbil Alameen. Wa usalli wa usallim ala al-mab'uth rahmatan lil alameen. Nabiyina Muhammadin wa ala alihi wa sahbihi ajma'een. Today, inshallah ta'ala, as the sister mentioned, we have a very, very important topic with us. And these are the questions which come time and time again each year about these contemporary things that break the fast. All of us know that the scholars said that, the eating and drinking, intercourse, if the woman starts her menses, all of these things break the fast. But what about these contemporary things, the inhalers, different medications, injections, if we take eardrops or nose drops, do these things break our fast or not? This, inshallah ta'ala, is what we're going to learn today. And the first thing, we have about 42 different things we're going to mention, inshallah ta'ala. We can't go into too much detail in the time frame we have, but inshallah, we'll try to cover in this hour all of them, inshallah ta'ala. So starting with the first topic, with that of inhalers. For those who have asthma, if they have to use their inhaler during the daytime in Ramadan, does it break their fast or not? There are different types of inhalers. You have to understand this. The main type of inhalers that we know, which is made up of a little bit of water and oxygen and other medications, there's a difference of opinion. Do these break the fast or not? And the correct opinion is that these inhalers do not break the fast. And this is the opinion of Shaykh Baz and Shaykh Nullifiers and the Lajna al-Da'ima, the Permanent Committee for Fatwa in Saudi Arabia. And their evidence for this is using the qiyas or the analogy of the madmada and the istinshaq. During the month of Ramadan, all of us know that we make wudu, and we have to make the wudu. We have to rinse inside our mouth, and we have to put the water or the istinshaq inside of our nose and take the water out. And this does not break the fast. And this is the agreement of all of the scholars. We have to do this, and this does not break the fast. So the scholars use the same qiyas, the same analogy here, because they said if you look at the inhalers, the regular size inhalers, they said there's about 10 milliliters of liquids for about 200 sprays. So it's a very, very small amount. So just as when you make wudu, a little bit of water is going to stay in the mouth, there's no way around that, that also the amount of water that would come in or liquid that would come in from the inhaler is so small that it wouldn't have an effect on the fast. Secondly, they said that the fact that it actually enters down into the stomach, this is something that is a possibility. It's not 100% certain that it actually does reach into the stomach. Therefore, it's clear that it does not break the fast. Also, the scientists mentioned, when you look at the miswak, which we're allowed to use at any time during the day when we're fasting, that this contains certain materials with it as well. And some of this obviously will reach into the stomach, and this doesn't break the fast either. So the same ruling comes when it comes to the main type of inhalers that we talked about, that they do not break the fast, inshallah ta'ala. Now, the other type of inhalers are the ones who have like a capsule with it, and it breaks the capsule, and then you have to take all of it, and it comes like a dust in a dust form. This type, it breaks the fast. This is the opinion of Shaykh Ibn Uthaymeen and others, rahimahullah. This breaks the fast because it's been proven that a big portion of this will go down into the stomach. Therefore, this type breaks the fast. And actually, subhanAllah, brother just asked me about this the other day because he had a bronchial infection in his chest, and he had to use this to be able to breathe during Ramadan. So alhamdulillah, this would break his fast, and all he has to do is make up his fast after Ramadan when he's healthy, inshallah ta'ala. The second issue is that of oxygen. Does oxygen, if we need to use oxygen, break our fast or not? And the ruling is the same as the main type of inhalers, that it does not break the fast, it does not invalidate the fast, inshallah ta'ala. And this is the Al-Majma' al-Islami, Islamic Fiqh Academy. The third issue is that of the medications which are placed under the tongue. There's some lingual medications they put under the tongue, and it dissolves, and it's absorbed by the body. Does this break the fast or not? And usually these are used by people who have heart conditions. So they put it under the tongue, and then it dissolves into the mouth, and it dissolves into the body. These do not break the fast. They do not break the fast. And there's some very important principles on this issue. I want you all to pay very close attention to it, because there's a principle I want to mention that we're going to use it for a lot of the things that are going to come to understand certain ruling that the scholars mentioned. And that is, the scholar said, al-fam fi hukum al-zahir, that the mouth takes the ruling of an exterior body part. It doesn't take the ruling of an interior body part. So the mouth, always remember this, that it takes the ruling of the exterior body, not the interior body. Therefore, these type of medications, they dissolve into the mouth and into the body, and it doesn't reach into the interior of the body, known as al-jawf, and it dissolves in the mouth and it becomes completely absorbed. Therefore, it does not break the fast, inshallah ta'ala. The fourth issue we have is the gastroscope. When they put it into the mouth and it goes into the stomach, does this break the fast or not? The majority of scholars say yes, it does break the fast. All of them said if it breaks the fast, except for the Hanafi scholars. They said that, and they put as a condition, extra condition, that it must be stabilized inside of the stomach for some time and then comes out. But nonetheless, it's all basically the same. The opinion that the majority of the scholars said that this does break the fast. And they used for their evidence the hadith that the Prophet ﷺ forbid us from using kuhul, the kuhul, or putting the kuhul into the eyes while we're fasting. And we'll talk about this hadith in a minute, inshallah ta'ala. The second opinion is that this type of gastroscope does not break the fast. And this is the opinion of Shaykh al-Islam Ibn Taymiyyah rahimahullah ta'ala and some of the Maliki scholars. And they said when you look into the Quran and the Sunnah, the things that break the fast are the nourishing things. And here this is not nourishing. And they said that the hadith of the kuhul that the majority of the scholars use here for their evidence, this hadith is da'if. The hadith which says we cannot use the kuhul when we're fasting, the hadith is da'if. It's not authentic. Therefore, we cannot use it as evidence to forbid kuhul or to forbid things similar to kuhul as well. Because they said the kuhul from the eye, it's going to go into the body, and then it's going to go into the same ruling that he's saying here, that when this gastroscope goes into the body, it's going to break the fast. Some other scholars said they took the opinion of Shaykh al-Islam Ibn Taymiyyah, and perhaps this is the stronger opinion, that it doesn't break the fast, but they put a condition. And that condition is that there's no like creams or ointments that has a nourishing substance on them, that if it were to go into the body with these creams or these ointments, then it would break the fast. But if it was a gastroscope without any ointments on it or any creams, then this would not break the fast, inshallah ta'ala. The fifth issue is that of nose drops. Do nose drops break the fast or not? And number 6 is nose sprays. So we have nose drops and nose sprays. So pay attention to the difference between the two. So the nose drops. The A'immat al-Arba', the four Imams from the Hanafis, Malikis, Shafi'i, and Hanbali madhab, all of them, they say that the nose drops break the fast. And this is also the opinion of Shaykh Ibn Baz and Shaykh Al-Uthaymeen, rahimahullah. And their evidence is the hadith of Laqit ibn Sabara, radiyallahu an, which came in the Sunan of Imam Abu Dawood and At-Tirmidhi, where the Prophet sallallahu alayhi wasallam said, وَبَالِغْ فِي الْإِسْتِنْشَاقِ إِلَّا أَن تَكُونَ صَائِمًا, and sniff water deep into the nose, except if you are observing the fast. How is this evidence? What does this prove? They said that this proves that the nose is one of the access points to the stomach. Pay attention. The fact that the Prophet sallallahu alaihi wasallam told us that we should make mubalagha fil istinshaq, meaning that we should snuff the water deep into the nose when we're making wudu, except at the time we're fasting. This proves that the nose is one of the access points to the stomach. And that's why the Prophet sallallahu alaihi wasallam, he forbid us from sniffing water deep into the nose while we're fasting. Therefore, these scholars said very clearly that the nose drops break the fast. And anybody has used nose drops knows, and when you put it back and you put the nose drop in, that it goes back and you can taste it right away in your throat, and it goes down later into your stomach. As for nose sprays, the correct opinion is that it doesn't break the fast. Why? It takes the same rulings that we mentioned in the first issue about the inhalers, because it's going to evaporate before it goes deep into the nose. And the nose spray, you're going to do it from the bottom, as you know. So it's going to evaporate before it goes back, and there's not going to be much of anything left by the time it gets to the end of the nose. Therefore, the nose sprays don't break the fast, but the nose drops do. So pay attention to that and the difference between the two. Now, when it comes to the ears, number 7 and number 8, we have the ear drops, number 7, and number 8, we have the different type of fluids they use to clean out the ears. For example, if there's a buildup of wax and they put it in there for 30 minutes or so, an hour or so, and then they take the wax out, that's number 8. But when it comes to ear drops, the correct opinion is that ear drops do not break the fast. Why? Because modern medicine has proven that there's no connection between the ear and between the interior of the body, the jawf. There's no connection between the ear and the interior of the body, the jawf. Except if there's a tear in the eardrum or something wrong with the eardrum, that's different. But a normal eardrum, there's no way for any liquid to reach in. Therefore, eardrops do not break the fast. And this is the opinion of Shaykh al-Islam Ibn Taymiyyah and Imam Ibn Hazm as well. And also the same ruling for number 8, for those type of fluids they use to remove wax and what have you in the ear, that also these do not break the fast, inshallah ta'ala. The 9th issue is that of eye drops. And here there's 2 opinions. One, that it doesn't break the fast, and the other, that it breaks the fast. The ones who say it doesn't break the fast, this is the opinion of the Hanafi and Shafi'i scholars. And it's also the opinion of Shaykh Ibn Baz and Shaykh Al-Uthaymeen, rahimahumullah ta'ala. And their proof is the same qiyas, the same analogy that we used before when it comes to the issue of the madmada. When we make the madmada when we're fasting, there's going to be a little bit of water left, but it's not enough to have an effect on going down to the stomach to break the fast. Therefore, the same ruling here, because once you put the eye drop into the eye, it's been proven that it's such a small amount as it runs through the canal there in the eye that it's going to dissolve. It's going to dissolve, and there's not going to be any effect left afterwards, inshallah ta'ala. Therefore, they said it doesn't break the fast. The other scholars said, and they are the Maliki and Hanbali scholars, that if anything from the drop reaches to the throat, that it breaks the fast. And they also use as their evidence the hadith of the kuhul, that's forbidden to use the kuhul because you can find the effect of the kuhul in the throat. However, we said this hadith is not authentic. Therefore, perhaps the stronger view is that of the Hanafi and Shafi'i scholars, that it doesn't break the fast. You can use eye drops and it doesn't break the fast, no problems, inshallah ta'ala. The number 10, similar to number 9, which is that of contact lenses in solution you have to put it into your eye, the same ruling as the eye drops, that it doesn't break the fast, inshallah ta'ala. So that's 10 issues now that we've covered from the contemporary acts that either break our fast or do not break our fast. Starting now with number 11, and that is anesthesia. If we have to do some type of operation during the month of Ramadan and we have to use anesthesia, does it break our fast or not? First of all, there are two, or you might be able to say three types of main types of anesthesia. The local and general anesthesia, and you could even say the regional anesthesia. The local anesthesia, which involves numbing a specific part of the body to prevent the feeling of pain during these procedures. And the regional one, it's similar to the local, but it will be a larger part of the body. So, for example, it would be the entire leg and not maybe just the ankle. So it's basically very similar to the local or the regional anesthesia. And it's given by either gas or by injection, either given by gas or injection. Alhamdulillah, both of these types of anesthesia, whether local or regional, they do not invalidate the fast. They do not break, inshallah ta'ala. Why? Because this type of gas and medication, it is not something that is nutritious, and it's not in the meaning of food or drink. Therefore, it doesn't have any effect on the fast, inshallah ta'ala. The other type of anesthesia is the general anesthesia, which it suppresses the central nervous system activity and results in the unconsciousness and total lack of sensation. You're going to be out once you go under the general anesthesia. And here the scholar said there's two types of possibilities. Either you're going to be out for the entire day, or you're going to be out for part of the day. If you're out for the entire day under anesthesia, then the majority of the scholars say your fasting is invalid. Your fasting will not be correct, and you have to make up the fast for that day that you were under anesthesia. The second possibility is that you're under the anesthesia for part of the day. And here there's three different opinions. Pay attention. Three different opinions if you're under anesthesia for part of the day. The first is that the fasting is correct. If you're awake for a portion of the day, that the fasting will be correct. There'll be no problem with the fasting, inshallah ta'ala. And this is because the niyyah to fast happened, even if it was only part of the day, so it will be correct. And this is the opinion of the Shafi'i scholars and the Hanbali scholars. And because they have this issue from before with the issue of al-mughma alayhi, this is actually an old issue, which they use the same analogy here for the anesthesia now. If somebody's passed out for the entire day, is his fasting correct or not? So here, the same ruling, he said if it's for part of the day, then his fasting will be correct. The Maliki scholars said his fasting will not be correct. And the Hanafi scholars said his fasting will not be correct unless he wakes up before noontime and he renews his intention, then his fasting will be correct. So this is the different opinions. And the strongest view here is the first opinion, that of the Shafi'i and Hanbali scholars, that the fasting is correct if someone is under anesthesia for a part of the day, even if it is the majority of the day. And I'll give you an example how we know this is the correct view. If, for example, somebody were to pray Fajr and he makes his intention to fast, he has his suhoor, he prays Fajr, and then he goes to sleep. He's very tired. He oversleeps. He doesn't wake up for Dhuhr, he doesn't wake up for Asr, and he wakes up after the Maghrib. He slept for the entire day. Also, his fast is going to be correct here because his intention was to fast during this. It's a bit different, obviously, because obviously he didn't mean to wake up here, but and when he went under the anesthesia, he knew he was going to be out for that time. But nonetheless, the same ruling stands where the fasting will be correct, inshallah ta'ala. The 12th issue is that of injections. And when it comes to the injections that we can take, there's two main types of injections we want to talk about. The injections that are not, they're medication, but there's no nutritious, they're not nourishing injections. There's nothing nutritious in them. These type of injections do not invalidate the fast. The injection you take, it's a medicine, but it's not, there's nothing nourishing or no nourishment in them, nothing which would be equivalent to food or drink, then these do not break the fast, inshallah ta'ala. This is the opinion of Shaykh Baz and Shaykh Nullifiers and the Lajna Da'ima, the permanent committee for fatwa in the Kingdom of Saudi Arabia. And this is because the origin is that the fast remains and it cannot be broken unless there's clear evidence, and there's no evidence saying that something like this will break the fast. And also it's not because always the things that break the fast are the things that are food or drink, or that which comes in the meaning of food and drink. And here these are not coming in the meaning of food and drink, therefore they do not break the fast. Now the second type of injections are the nutritious ones that nourish the body. And here the vast majority consider this to invalidate the fast. From them is Shaykh Ibn Baz and Shaykh Nullifiers and the Mujamma al-Fiqh al-Islami, the Islamic Fiqh Academy. All of them said that these type of shots, these type of injections, they break the fast. So here, this is, and also modern medicine proves that the vein is one of the ways of nourishing the body. Therefore, that's why you have somebody who was sick and he puts in the drip instead. Somebody can be unconscious for several weeks or months, and he's getting nourished through these type of drips. So if somebody's giving you a drip or a different type of injection, which is nourishing to the body and has nourishment in it, then these break the fast. You might ask for yourself now, how are we supposed to know, the general people, which shot we're taking, if it has something nourishing or not? Allah subhanahu wa ta'ala told us, فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنتُمْ لَا تَعْلَمُونَ. Ask the people of knowledge if you do not know. And here the people of knowledge are the trustworthy doctors. When you're going to take an injection, you need to make sure what type of injection you're taking. If it's just a medication, it has no nourishment in it, it's not nutritious, then this doesn't break the fast. If it is nutritious and it nourishes the body, then here this type of injection breaks the fast, inshallah ta'ala. Issue number 13 is that of the insulin injections. And insulin injections do not invalidate the fast. Insulin injections, alhamdulillah, do not invalidate the fast. And number 14 is, obviously insulin injections, they're not food or drink or that which is equivalent to food or drink. So the same ruling comes once again. So these principles that we're mentioning, you always have to build on them. Once you understand these principles about what is food and drink or equivalent to food and drink, that you're going to build a lot of different rulings on them. So here the same ruling comes when it comes to the insulin, that it does not. Number 14 is skin patches or creams that are absorbed by the body. Different types of medication, which we put either through a patch or through a cream that we put onto our body, and then the skin absorbs it and it goes into the body. This does not invalidate the fast. It has no effect. The fasting is correct if we use these patches or creams, inshallah, these creams, inshallah ta'ala. And this is the position of the Islamic Fiqh Academy, the Majma' al-Fiqh al-Islami as well. Number 15 is laser skin treatment. Is it permissible to do different type of treatment or hair removal or different type of treatment with the laser during the fast? The same ruling has no effect on the fast whatsoever. So if a sister wants to remove some hair, have hair removal during the month of Ramadan, it's permissible. And what about for the brothers? Is it permissible for them to remove the hair? And people think that's strange. No, times are changing now. So even we have brothers who are asking if they want to remove body hair now. Is it permissible or not? Here's a very important principle to understand when it comes to the hair of the body. There's 3 different types of hair on your body. Understand this. You understand it whenever it comes to removing or keeping different types of hair. It'll be easy for you, inshallah. We have a type of hair that we've been ordered not to remove. We have hair that we've been ordered to remove. And we have hair that nothing was said about keeping it or removing it. An example of the first type for the men, obviously, is the beard. We've been ordered, obviously, not to trim our beard or not to shave our beards. And also the issue of the eyebrows for men and women fall into the same category. Shaving the head for women as well, something that is haram. So this is something, these are the types of hair that we are commanded to keep. You have the second category, the ones we are ordered to remove, which would be, for example, the armpits, obviously, and the pubic hairs. These we've been ordered to remove. The other types, where nothing was said, for example, the hair on the chest or the hair on the back. Here, obviously, for women, it's always better to remove all of these types of hair, even the arms and what have you, as it is in most Muslim countries, most Muslim customs. where the women remove the hair from the entire body. That's something that is permissible and good, inshallah ta'ala. When it comes to the men, here we have to say you need to be careful. If a man is like super hairy and like abnormal hairy, then here it's no problem for him to remove the back hair or the chest hair. But if it's a normal hair he has in the back of the chest, then you have to be careful that you don't want to fall into the imitation of women and imitating women, because it's something other than haram. It's something that's been cursed in the sunnah of Rasulullah sallallahu alaihi wasallam of the men who imitate the women. So it falls in now. You have a man who has a bit of hair on his legs and he removes his hair on his legs. That's something that you might be scared could fall into imitating the women. So here you must be careful of that. That's a bit off topic, but beneficial inshallah ta'ala when it comes to the issue of hair removal. Number 16 is the arterial line, the line that's put into the artery, which is inserted into the artery. It's most commonly used in like intensive care medicine or anesthesia to monitor the blood pressure, and it also to obtain different samples of the blood gas analysis and what have you. So these type of lines which are put into the artery, they do not invalidate the fast. They have no effect on the fast because it doesn't reach into the interior of the body of the jawf, and it's not food or drink or that which is equivalent to them. Therefore, it has no effect on the fast. And this is the fatwa of the Majma' al-Fiqh al-Islami, the Islamic Fiqh Academy. Alhamdulillah. Number 17 is the dialysis or the ghasil al-kilawi, which is the process of removing the blood from the artery. And usually, obviously, you see this happening with the ones who have kidney failure and problems with their kidneys. So they purify it by this dialysis, by adding the vital substances and then returning it into the vein. And during this procedure, the patient will need continuous nutrients and fluids. Therefore, obviously here, it will break the fast. If somebody has to go through this dialysis during a fast, this will break his fast and he'll have to make up his fast, if possible, from another time, inshallah ta'ala. There's another type that the scholars mention as well, which is the small tube which enters under the stomach from above the belly button, and then fluids which have a high percentage of sugar and glucose enters and stays inside for some time, and then it's taken out. Also, this invalidates the fast. And this is the position of Shaykh ibn Baz and Uthaymeen and the Lajna al-Da'ima, the repositories that you put in. You have number 18 and 19. Either the ones that are put in the rectal one, or the ones that are put in the women. The ones that are put in through the vagina for the women, these do not break the fast. These do not break the fast. And this is the opinion of Shaykh ibn Baz and Shaykh Uthaymeen and the Lajna al-Da'ima, the fatwa, the permanent committee of fatwa. And this is because, and this is an important principle to understand when it comes for the sisters, is that it's been proven that there's no connection between the vagina and the stomach, meaning something that will enter through the vagina, it doesn't reach into the stomach. Therefore, these type of things that even we're going to mention later with the scope as well, that they have to examine the uterus and all this, these type of things do not break the fast and has no problem for the sisters to use these things. So these type of medications she had to, or the suppositories she has to put in during her fast, it has no problem for the sisters, inshallah ta'ala. The other issue is that of the rectal suppository, and the majority of the scholars here say that it does break the fast. And from them is the A'immat al-Arba'a, the four Imams, from the Hanafi and Maliki, Shafi and Hanbali madhabs. And they say that it breaks the fast because it's been proven, they say, that through the rectum, that it can enter into the internal part of the jawf of the body, the jawf, the internal part of the body. Therefore, it breaks the fast. There's another opinion, which is the opinion of the Zahiri madhab and also of Shaykh al-Islam ibn Taymiyyah and of Shaykh ibn Uthaymeen rahimahullah, that it doesn't break the fast. And they said this is because it doesn't contain these type of medications which are put in through the rectum. They do not contain any type of food or drink or something nourishing, or it's not equivalent to food and drink. It only has medications in them. Therefore, it doesn't break the fast. So, perhaps this opinion is actually stronger. When you look at their evidence and their argument, that seems to make more sense because it's not something nourishing. It has no, there's no nourishment in these medications that are put in. Therefore, it wouldn't break the fast. However, since there is a clear difference of opinion between the scholars, and you have the 4 imams, all who say that it breaks the fast, it's much better that we try to avoid these during the month of Ramadan. And if we had to use these type of suppositories, that we would make up the fast, inshallah, just to be on the safe side. The other, number 20, we reach now, which is the scopes that they use to examine the anal scope. This type is very similar to what the gastroscope when it comes to the ruling, which you mentioned in number 3, and that it doesn't break the fast, but under one condition, and that is that there's no ointment or any nourishing substance on it. So if the same condition is met, then this also will not break the fast, inshallah ta'ala. Number 21 is the cystoscope, the one that they use to examine the bladder. This type of scope as well, it doesn't invalidate the fast. This type of scope, it doesn't invalidate the fast. Why? Because modern medicine has proved that there's no relation between the urinary tract, the tract and the digestive system. So if it's put in this type of scope, it will not have any effect. Also, the tubes which are put in other parts of the body to allow the urine to come out, also this has no effect on the fast as well, inshallah. So this...
Shaykh, I apologize, but once I saw your screen freeze, I panicked and I forgot about everything besides how we were going to get you back on. So can somebody post in the box for us the very last thing that he said? I mean, I know that he was on the topic of bladder and the scope testing that they do for the bladder, and that was the last thing that I recall about this. Does not invalidate the fasting due to the fact the bladder has nothing to do with the stomach.
Okay, very good. Yeah. So that okay, we finished that one then. So that was number 21. Now 2 and 23 and 24, which is about donating blood and the different type of blood tests that we can take during fasting. So when it comes to donating blood, number 22, this issue is an issue that the scholars differed upon qadiman, a long time ago, and that is the issue of the ikhtilaf that they have, the difference they have when it comes to the hijama, or the cupping as we say today. Now, does the hijama break the fast or not? The majority of the scholars say that it doesn't break the fast. But Imam Ahmed and the Hanbali madhab, they say that it does break the fast. And their evidence for that is the hadith of Rasulullah sallallahu alaihi wasallam, which is clear in this issue. Aftar al-hajim wal-mahjum, that the one who gives the hijama, who does the cupping, and the one who has the cupping or the hijama done to him, that his fast is broken. His fast is invalidated. Therefore, this is clear that the correct opinion is the madhab of Imam Ahmed, that the hijama breaks the fast, inshallah ta'ala. And very similar to the hijama is donating blood, because the amount of blood that you will give out, when you donate blood is a large amount of blood that will weaken the body. Therefore, it breaks the fast, inshallah ta'ala. So if you donate blood, you should not do it during Ramadan unless it's a necessity. People are in need of blood. It's an emergency. You have a rare type of blood that people need and you donate it. If you were to donate this blood, you would have to make up your fast, inshallah ta'ala. It would be permissible if it was for necessity, but you would need to make up your fast, inshallah ta'ala. Now, number 23 and 24 are about the blood test. And we have 2 types of tests we're going to talk about, which is, first of all, the little prick that they do to just test a small amount of blood, when they do like on your thumb, or the other type is the one they do when they take it out of the vein. And both of these types of blood tests do not break the fast. They do not invalidate the fast. Why? Because it's a small amount of blood. And secondly, it doesn't weaken the body like the hijama. So it's not in the same meaning as the hijama. Therefore, these types of blood tests do not break the fast. Number 25 is toothpaste. The question every year, does toothpaste break our fast or not? This question, subhanAllah, we should know it by now, but nonetheless, it's from the modern issues that we have to make clear. And alhamdulillah, the toothpaste, you can say it's makruh. It's makruh, and we shouldn't use it unless we have to. But it's not haram. It is permissible. It is permissible to use, and it does not invalidate our fast. But it's better that we stay away from it just in case. And it's better that we use the miswak, as it was mentioned in the Sunnah of Rasulullah sallallahu alaihi wasallam. This is something that is better. Somebody asked me when I was giving this lecture before, said, "What if I'm from the people who swallow the toothpaste? May I become accustomed to swallow toothpaste?" And maybe that changed, but some people apparently do. Well, somebody who swallows toothpaste, and that's his custom, definitely something he needs to stay away from. Could even be used it because he knows he's going to swallow it, maybe not even thinking about it, away from using toothpaste. Like other issues which come under toothpaste, what about using a flavored miswak? Is it permissible or not? And here when we ask this question, people get confused right away. They say, it's haram. It's flavored. So what's the difference between a flavor and between toothpaste? No difference. It has the same ruling. It's permissible. Miswak, the ones who are in the wrapper, they come with the lemon taste or lime taste or the mint taste. Then this is something that permissible, but the same ruling, you just don't swallow it. You need to spit it out if you're going to use it, inshallah ta'ala. Number 26 and 27 go back to the issue of mouthwash and different medical gargle that you use in different medical procedures. When it comes to mouthwash, which could be used for medical reasons, like for example, after an operation or having a tooth removed, regular mouthwash which we use for our breath. And I want to point this out, even if we go back to the toothpaste, number 25, many people, they say, yeah, but my breath stinks when I'm fasting, so I have to use a different type of toothpaste or a mouthwash. You need to know that the smell when you're fasting, it doesn't come from the mouth itself. The foul smell is coming from the empty stomach. The stomach being empty, and that foul smell is coming from within the stomach. And that's where the smell is coming from. It's not coming from the actual, the actual mouth itself. So even if you use a toothpaste or mouthwash, it's not going to make that smell go away. So using regular mouthwash, hands down, this is something that's makruh and should be avoided. But when it comes to other medical reasons, for example, after an operation or a tooth removed, if it's something necessary, then you can do it, but it's better you delay until Maghrib, okay? And once again, how do we know that it doesn't invalidate the fast? The same principle that we mentioned in the past, and that is that hukmul fam, hukmul zahir, that the mouth takes the ruling of an exterior body part, and it doesn't take the ruling of the interior body. So the mouth takes the ruling of the exterior body, not the interior. So therefore, it does not invalidate the fast, inshallah ta'ala. Also types of medical gargle that they use, for example, if you have a throat infection or something with the tonsils, here, this is also permissible if it's a necessity, meaning it must be used. But here it's a bit more dangerous. Why? Because this type of gargle is going to go usually deeper into the mouth all the way back. Even if it goes all the way back, as long as it doesn't go into the throat itself, even if it comes to the start of the throat without entering into the stomach, it doesn't invalidate the fast. But it should be avoided if possible, inshallah ta'ala, because this type of gargle can go you have to use it in the back of the mouth, and it could very easily go into the throat. Therefore, this is something that definitely should be avoided, inshallah ta'ala, while fasting. But if it was a necessity that you had to use it for a different procedure or what have you, then it would be permissible as long as it doesn't go down to the throat, into the stomach, inshallah ta'ala. Then what about the different scopes that they use to check into the throat, going to the throat area? The same ruling as before. This is number 28, that also this doesn't break the fast. It doesn't invalidate the fast as long as there are not types of ointments and creams on the tube, as we mentioned before, inshallah ta'ala. Number 29 is pulling out a tooth. If we have to get our tooth pulled during Ramadan, is it permissible or not? Having your tooth pulled in itself, it doesn't break the fast. It doesn't break the fast. But some of the scholars said here, clearly it's makruh. It's something that should be avoided during the fast if possible. But however, there could be some certain scenarios where we have to do it in Ramadan. For example, if it's severe pain and you have to get that tooth pulled, then you have no choice but to do it during the month of Ramadan. Or, for example, you've been waiting for a very long time for an appointment, and this happens a lot of times in government hospitals in certain countries where you wait for a long time and then your appointment comes during the month of Ramadan. Here in Shaykh, it's permissible to you to have the tooth pulled. And why we say it's permissible? Because the local anesthesia, as we mentioned before, and also the only large amounts of blood will break the fast. And here it's a very small amount of blood that you'll be bleeding, so it's not going to have an effect on the mouth as well. And also with the issue of mouthwash, we just mentioned, it's permissible to be used because you're going to.
The Shaykh is back, so please go ahead and continue, Shaykh, with the lecture.
Bismillah. What was the last thing that was said about the dental implant and the dentures?
Actually, the last thing that we were discussing was the tooth extraction. And while I'm on here to remind you, I'd just like to ask you to elaborate on that a little bit, because I'm a little bit confused. Because when you do get your tooth extracted, they usually give you anesthesia, which means that your gag reflex and swallowing reflex would be off. So the chances of swallowing, saliva, water that they're using to rinse the area with or whatever, it's going to increase. And I'm just wondering, so what about that? I mean, is it still permissible to do it even with taking all of that into consideration?
Yes, it's an interesting point what you're saying, but as I mentioned before, the local anesthesia has no impact on the fast. What you're saying, some of the reflexes might be weakened, it's true, but nonetheless, the origin, I think most of us even see that you don't feel like you swallow anything because it all kind of gathers up in your mouth. At the same time, they have the suction thing where they're pulling it out. It's being sucked out or vacuumed out of your mouth as well during the operation. So, and it's not a huge possibility that you're going to swallow it. So we said that the local the anesthesia doesn't affect. Also, the amounts of blood that are coming out are very small, so it doesn't have an effect. And even the mouthwash you have to use or the gargle you have to use during this operation, you're going to spit it out and you're not going to swallow it. So it doesn't have any effect, inshallah. So having the tooth extracted or pulling out the tooth doesn't invalidate the fast, inshallah ta'ala. Now, number 30 is that of filling cavities. If you have to get your cavity filled, it takes the same ruling as having the tooth pulled, no problem, inshallah ta'ala. Also, we mentioned before we were cut off the issue of having the teeth whitened or laser that they use for teeth whitening, that this has no impact on the fast. It doesn't invalidate the fast. Once again, we have to be careful that we don't swallow any of the types of water or medication that are used during this, inshallah ta'ala. Dental implants, which is an artificial tooth root that is placed into your jaw to hold a replacement tooth or bridge. This has the same ruling as mentioned before, that this doesn't have any impact on the fast. It doesn't invalidate the fast, inshallah ta'ala. When it comes to the dentures, that's number 33, there's two possibilities. That you put it back in your mouth after it is dry, where there's no like denture cream on it, and this does not affect the fast, inshallah, no problem with this. The other one is that it has these creams on it when you put it back in, and here some of the scholars said that this does break the fast, because here obviously this type of cream is going to enter into the interior of the body, so it will break the fast. So here, with some of the scholars saying this, it's better if you have dentures and you have to take them out during the day, that you don't put any of this type of cream or ointment on it and then put it back into the mouth, inshallah ta'ala. Number 34 is blood transfusions. And blood transfusions, they invalidate the fast. The blood transfusions, they invalidate the fast. And number 35, and this is something now which is become quite common for those who haven't been blessed to have children, and that is artificial insemination. Artificial insemination, does it break the fast or not? And before we mentioned the ruling, the scholars said that it's very, very important upon us that we realize, and this is the Al-Majma' al-Fiqh al-Islami, the Islamic Fiqh Academy, when they talked about this, they said that there's certain types of artificial insemination which are halal, and there's certain types which are haram. So pay attention to this, because there's certain types that are halal, it might register into our mind that all types are halal. But there's certain types that are halal and certain types that are haram. We're not going to go into that detail now, but it's important if this is something that you're going to do, that you look into it beforehand and don't just think that all types are halal because you heard that some types are halal. So an example of a type that would be halal, just one example to make it clear, is, and that's found in many Muslim countries, where they take the man's semen and the woman's egg and they inject the semen into the egg and then implant it into the woman's womb. This is a halal type, no problem with this, inshallah ta'ala. Now here, when it comes to the fast and the impact it has on the fast, and some people might just say, let's just wait till after Ramadan. And obviously this is better. Even what Sister Yasmin was asking about the tooth, we said the same thing. If it's possible, and many of these things, if you can wait until after Ramadan, wait till after Ramadan. Certain things, if you can wait until after Maghrib, wait till after Maghrib. It's always better, especially if there's an ikhtilaf or difference of opinion. So if you can wait till after Ramadan for these type of things, wait till after Ramadan. But when it comes to this issue, subhanAllah, recently, a couple asked me when I was in Kuwait about this ruling. And they said, we started the procedure, the medication, and now it fell into Ramadan where we have to actually do this artificial insemination. So is it permissible or not? I heard their case and what they did. I told them, alhamdulillah, it is permissible for them to do it in their current situation, alhamdulillah. Now here, there's a ruling for the man and a ruling for the woman. A ruling for the man and a ruling for the woman. And when it comes to the man, he will be forced here to ejaculate. So, and he obviously, him being forced to ejaculate for this procedure will cause him to break his fast with the majority of the scholars. The majority of the scholars say that his fast will be nullified. Unless there's a way he could abstract the semen, obviously, and ejaculate before he starts his fast. This would have to go back to the medical, those who are professional, those who actually do this insemination, to be able to tell you does it have to be done there on the spot or done before this. I don't know. If it can be done a few hours before Fajr, that would be better. Obviously, it wouldn't affect his fast. But if it must be done there on the spot, and there's no option for him but to do it there, then it would be permissible for him to do it, but it would break his fast, and he would have to make up his fast after Ramadan from another day, inshallah ta'ala. As for the woman, does it affect her fast or not? It has no impact on her fast. It does not invalidate her fast. Her fast is correct. Why? Because there's no connection, as we mentioned before. Go back to, always think about, and as the sister mentioned, once you know these rulings, you have certainty and clarity on what you do when you fast. And you know what is permissible, what is not. This is the important of this topic. So here, we said there's no connection between the womb and the stomach. And implanting the semen doesn't take the ruling of intercourse. It's much different. It doesn't take the ruling of intercourse, and it's not a form of intercourse. Therefore, it doesn't break the fast. It has no impact on the fast for the woman and only on the man, as we mentioned, inshallah ta'ala. But what about the estoscope, or the scope that they use to examine the uterus for the women? Also, we say they use it obviously to diagnose or treat causes of abnormal bleeding and these type of things. This does not break the fast as well. Okay, even if the scope has different ointments or creams on it, it doesn't break the fast. Once again, because of the ruling, which has been proven from modern medicine, that there's no connection between the womb and between the stomach. But what about the devices, the IUD or the coil device, which is a small, like T-shaped birth control device that the women use? And this is number 37 on our list here. They put into the uterus to prevent pregnancy. Pregnancy. Does this have an impact on the fast? Same ruling. Just like the ones we mentioned before, it doesn't affect the fast. It does not invalidate the fast in any way, inshallah ta'ala. The scholars talked about, and this is number 38, when it comes to any type of treatment that is done on the brain or something is done on the brain, this has no effect on the fast and doesn't invalidate the fast as well. Unless, for example, somebody have to go under anesthesia for a long time, that goes back to the difference of opinion that we mentioned. But there's something, any procedure done for the brain, this does not invalidate the fast. Number 39 and 40. 39 is smoking, 40 nicotine patches. And I know those who were paying attention with us from the beginning, when we talked about the creams or the patches, they've thought about the nicotine patches. Do these break the fast or not? When it comes to smoking, the scholars are unanimous that it breaks the fast. There's no difference of opinion that the The smoking breaks the fast, alhamdulillah. That's clear cut from the scholars. When it comes to nicotine, just like any other patch or any other cream, they do not break the fast. Nicotine patches do not break the fast. And I remember when I first gave this course, many people were surprised about this one. They were like, because they thought it took the same ruling, like smoking, because you're using it to get the nicotine from a different way. But it takes the same ruling because it's being absorbed by the body. That's why the scholars said that nicotine patches do not break the fast, inshallah ta'ala. But once again, they said it's better if you could wait and to put them on after Maghrib, just to be on the safe side. Then, I mean, something's better if you could do that, inshallah ta'ala. Number 41, medical hypnosis. Medical hypnosis, is it permissible or not? And medical hypnosis, it involves getting you into a relaxed state where the therapist can communicate with the subconscious part of the mind. And there's two types of categories of this type of hypnosis. One which is done for a short time, where he still has the understanding and senses. And here the fasting is valid. This does not invalidate the fast. There's no problem with this one, inshallah ta'ala, if it must be used, and it's used in a proper and obviously in a halal way by a trusted doctor, then this does not invalidate the fast. The second type is where you lose complete consciousness. And this is used for some types of operations. And this has the same ruling as we mentioned in point number 10 when it comes to the general anesthesia. So you go back to ta'ala. Number 42, and this is the last thing we're going to mention, inshallah ta'ala, in this lesson, in this lecture, which is from the contemporary action or contemporary things that come up each time in Ramadan. This doesn't come actually when it comes to invalidating the fast or the fast being correct, but this is something which comes up time and time again that the scholars talk about, and that is determining Ramadan by the calendar. Determining Ramadan or Eid by the calendar. And this is a problem that we face in the West time and time again from different schools of thought, from different contemporary scholars who have looked into the different ways of determining Ramadan other than the way that the Prophet ﷺ prescribed for us. And the correct opinion here is that it's not permissible. And this is something we need to go into more detail to explain in detail, but to make it clear with the amount of time we have, that it's not permissible to determine Ramadan or to determine Eid by the calendar. And the only way that it's permissible for us to determine is by the ru'ya, by the actual moon sighting. The Prophet ﷺ said in a very clear-cut hadith, he said, alayhi salatu wassalam, "Sumu li ru'yatihi, wafṭuru li ru'yatihi," to start fasting when you see the moon and to break your fast when you see the moon. And subhanAllah, that some of these groups in Europe, they issued this fatwa about using the calendar and, not actually going for the moon sighting, because they said this will make us fall into different opinion time and time again. What happens time and time again is that the people who follow this opinion of the calendar, they're the ones who are actually making the fitna and causing the problems between the Muslims. Because the majority of the Muslims who follow the moon sighting, there's usually not that much of a difference, alhamdulillah. Usually they follow, for example, many of them will follow Saudi Arabia, who has a very trustworthy group who goes out and actually does the moon sighting. So you have those who follow these groups, or some who in themselves. So usually they come together on the same sighting. But these ones who come and want to use the calendar to determine the beginning of Ramadan, they always call it a big fitna and divide between the ummah. Therefore, the only way for us to come together as an ummah is according to the Quran and to the Sunnah of our beloved Prophet ﷺ, who clearly stated, start fasting when you see the moon, and to not and break your fast when you see the moon. And therefore, it's not permissible for us to use these modern ways. The calendar can help us benefit, to have a rough idea. We can use what we have from the astronomy, from all of this, to have an idea. No problem with that. But it's not going to be the main thing we're going to focus on. The main thing is going to be the moon sighting. And that brings us to an end. But before we open up for the questions and answers, I don't know how much time we have left. I want to mention a principle when it comes to the things that break your fast in general. And it's very important to understand this principle, that none of these things that break your fast, even when it comes to the food and to the drink, to the water, and all of these types of things, none of these things break the fast. And we're talking about everything except excluding the women, if she starts her menstrual cycles or childbirth and things like that. That's a different ruling. Obviously, her fast stops right there. But when it comes to the other things that break your fast, none of these things break your fast unless there are three conditions that are met. Pay attention to this. And there has to be three conditions that are met. First of all, that a person knows that this action breaks his fast, meaning that he's aware of this. He has the knowledge that this thing actually breaks the fast. Okay. The second thing is that he remembers that he's fasting. So let's say that now I'm actually in Malaysia right now, and it's actually 1 a.m. They thought I was in Qatar, where I was before, when they announced in the beginning. So let's say, for example, it's Fajr time here, and I'm giving this, and mashallah, as you see, I'm sweating, mashallah, mubarak, and I'm into the lecture, and I forgot that the adhan was called. The adhan's 5:30, 5:40. But let's, for example. So I'm talking, I drink the water. Oh, astaghfirullah. I remember I'm in Malaysia, I'm not in Qatar. What's the ruling now? No impact on my fast. It doesn't break my fast because I forgot when I was fasting. The Prophet ﷺ, he said that if someone eats or drinks when he's fasting, when he is forgotten, that he should finish his fast. Allah subhanahu wa ta'ala has given him food and drink, alhamdulillah. Therefore, first of all, that we have knowledge. Secondly, that we remember that we're fasting. We didn't forget. And the third thing is that we do it voluntary, meaning we're not forced. You're not made to do it. And then what does this mean? Sometimes, subhanAllah, and some people thought about in the days we live in, how could you be forced to break your fast? But then we just heard last year about our brothers, may Allah make it easy for them, in certain parts of China, where they were forcing them to break their fast in the day. They would come to them and they would make them drink water during the day. So what is the ruling now for this person? As you're walking down the street and they ask you, and then here comes maybe with machine guns and this, and they say, are you fasting? And you say, no. They say, okay, drink this water. I drink the water, I have a machine gun in front of me. I was forced to drink the water. Does it break my fast? Doesn't break my fast because I was forced to do that. So anything you're forced to do, it doesn't break the fast. So the three conditions is that you do it out of knowledge. You know that it breaks the fast. Secondly, that you don't do it. You're not forgetful. You remember that you're fasting. And the third thing, is that it's something that is voluntarily. It's not something that you're forced to do. Shaykh Ibn Uthaymeen, rahimahullah ta'ala, and we'll end with this. He said, if a fasting person does any of these things that break the fast without meaning to, then his fast remains valid. Pay attention. If a fasting person does any of these things that break the fast without meaning to, then his fast remains valid. If he rinses his mouth and some water reaches to the stomach without meaning to, then his fast is valid. That's an example. So if anything's happened by mistake, you didn't do it on purpose, you didn't remember you were fasting, you didn't know that it broke your fast, then these are the conditions that must be met, inshallah ta'ala, in order for the fast to be broken. If they're not met, then it doesn't affect the fast, inshallah ta'ala. Barakallahu feekum.
Jazakallahu khairan, Shaykh McCarthy, for this amazing webinar. I learned so many new things today and was made aware of a lot of rulings that actually I hadn't really thought about. And I very much appreciate that. And I'm sure that everybody else benefited from this as well. I wanted to ask one question that was mentioned while you were discussing some of the various procedures. One of the brothers did mention that he has stage 2 kidney failure. So he has to drink, I think he said, a certain portion of water a day. I don't recall now how much he said, but it was a large quantity. So I'm just wondering, for people that have conditions like this where dehydration is detrimental to their health, what exactly is the ruling on whether they should fast or not? Because obviously fasting is not meant to harm somebody. Certain people with kidney issues, heart issues, they may not be able to fast.
Kidney issues, heart issues, also some diabetics who can't fast. In fact, actually you have to go back to the doctor. The doctor shows you what you need to do. And if you must drink water throughout the day, then and it's going to harm you if you don't, it actually becomes haram for you to fast. What people don't realize, it's like, no, you actually cannot fast. You're not allowed to fast. So here, obviously, you would make up, instead of the fast, you would feed a poor person for each day. You would feed a poor person for each day, inshallah ta'ala. There's another scenario what happened with some diabetics. I think for the stage 2 kidney failure, that's going to be more difficult. Therefore, he's going to have to what? He's going to have to take. He's going to have to drink a lot of fluids during the day. So therefore, obviously, I think he won't be able to fast at any time throughout the year. However, some diabetics, and this is I've worked with some patients before with this. What they tend to do is, like, for example, now fasting. It's in the summertime. It's hot, where they need to drink a lot of fluids. At the same time, the days are very long, so it becomes impossible for them to fast. However, if they were to delay it to the winter months, where it becomes cold and the days are shorter, it doesn't affect them. It's easy for them. Therefore, if this was the situation, then they could delay their fast and make it up during the winter months. However, even if the winter months, if they find it difficult and their doctors advise them not to, then they would they would just feed a poor person for each day instead of Shabbat. I see a question. I see a question about the fasting for 19 hours in the UK. Let me answer that one, please, if I can, because obviously there's something when I fasted in Ramadan last year in Ireland. How do we balance the fluids? It's actually not very difficult. I mean, if you try to at least drink about, and I had 5 hours a day or 5.5 hours in Ramadan in Ireland. You just make sure you drink enough fluids. For example, if I take a big thing of water like this has 1.5 liters, and I would put down about 2 of these a night. From the time I break my fast, you have 2 to 3 liters. It'll be enough for you during the day, inshallah. It won't be difficult, inshallah.
Okay, great. If there are any more questions, please go ahead and post those in the chat box. I know that we're really talking about medicines and procedures, but Shaykh, please, can you just clarify this one issue? Because all around the world, we're having the longest and hottest fasting hours, this year. So I know a lot of sisters want to breastfeed, even though they're fasting 14 and 19 hours. And I do recall reading a fatwa by Shaykh Uthaymeen, rahimahullah, mentioning that if this causes the mother to lose her milk, which is the hawk of the child, that she should not fast. Can you please just elaborate on this about, how much right the child has to have its breast milk as opposed to Allah's right, and how do we balance all of that, and give some real sincere advice to the sisters on this issue?
Yeah, I mean, it's exactly what you said, Sister Yasmin, that if the sister doesn't have enough milk, it's the haqq of the child to have that milk, and he needs that milk, he needs that nourishment. So it's better in this situation that she break her fast for her child. And here, all she would have to do is make up the fast during an easier, like we said, once again, we'll go back to make it up in the wintertime. It's easy to fast in the wintertime in most countries because it's cold, it's going to be colder and the days are going to be shorter. So all she has to do is make up the fast then, inshallah ta'ala. Some scholars said that she should feed a poor person each day as well. But the correct or stronger view is all she has to do is make up the fast for that day, inshallah ta'ala. So if she's not getting enough milk, she should break her fast. Or what she could do, maybe she could fast one day and not fast one day, because what we have to realize sometimes is that it might not just be the one day of fasting. It could be the accumulation, obviously, that it weakens the sister. So maybe if she fasts one day and then breaks her fast another day, and she sees she has the milk, then she continues and then breaks her fast the next day like that. So she could do that. But it is the haqq of the child, obviously, to have the milk. So it's better for her, especially the ones who depend on the breastfeeding. And that's something that we need to revive. And alhamdulillah, even a lot of non-Muslims now are really getting into this movement of going back to the breastfeeding and breastfeeding the children and not giving them the formula, which is actually, it's horrible. The formula is one of the worst things you can do for your child. And you should never give them this formula unless it's absolute necessity.
Yes, I have seen from some of the sisters and their practice of breastfeeding that they have actually claimed that they lost their breast milk, and they know that by fasting they will do that. And this, basically removes that, obligation to breastfeed them. And of course, we do know that children under 6 months are completely reliant on that milk. So this poses a great difficulty on the health of the child. And so basically, I think that the sisters need to rethink that whole issue. I mean, it's obvious that we can just make these fasts up at any other shorter time, correct, Shaykh?
Yeah, that's exactly what they should do, inshallah. Unfortunately, many of the Muslims, because it's Ramadan and we're in the zone, we're in that time that the people want to fast. Even some people who have, like we said, kidney problems or diabetics, they have other medical issues where they're not allowed to fast. It's actually haram for them to fast, but yet they fast. And even I know, subhanAllah, several of the people who have actually passed out, even people who have died because they didn't follow the fatwa of the scholars and the opinions of the doctors telling them that it's not permissible for them to fast.
SubhanAllah, Shaykh, the brother that I was asking you the question for, I think his name was Gary, about having the kidney issue, he just made that comment that he would literally fast until he passed out. And according to his name, I can see he's most likely a revert. Apparently he wasn't aware of the fact that he has a permission not to fast, especially if the doctor is telling him not to, or maybe he asked a Muslim without proper knowledge about this issue and they told him he needs to fast. And can you remind us of the story about the Sahaba that died because of somebody giving him false knowledge? So we really need to take caution on advising Muslims with health issues about whether they should fast or not.
Here, generally it's important to understand that there's three possibilities when it comes to breaking the fast and being sick. There's certain types of illnesses which don't affect the fast. You're a bit sick or a bit ill, but it doesn't, like you have a stomach ache or something like that, but it doesn't affect the fast. Here, it's not permissible for you to break your fast because of this type of illness. That's the first category. The second category is that it's difficult and there could be a slight amount of harm, but it's not really harming you, but you find difficulty with it. Here, it's permissible to break your fast. And some scholars say it's even better to take the permission from Allah and break your fast in the situation. Okay? Somebody, for example, has a fever, and the fever could be very difficult to deal with, or a heavy cold. Then it will be permissible, obviously, for them to break the fast. Another one is the one actually that it harms them when they fast. And this actually is haram for them to fast. And that, for example, Brother Gary in his situation, if it would make him pass out like this, that would be haram. It's not permissible even for him to fast. Perhaps he didn't know this before, and he wouldn't be held accountable. But now that he knows, it wouldn't be permissible, inshallah ta'ala. I'd like to make a quick announcement that I guess because I had my computer on for early time, I have 4% of battery left, so I don't know. And my charger's in the other house, so I don't know how long I will be able to answer questions. But if the brothers and sisters, I believe, maybe you could show them the YouTube recording. If they ask questions there, I will do my best to answer them on the IOU YouTube page, inshallah. But I'll continue until the battery gives out.
Shaykh, we don't want you to run out of battery on us, and we certainly don't want to keep you. So any questions that you have, inshallah, that do not get addressed, as the Shaykh is saying, you can go to our YouTube channel once the video is posted, and I'm assuming the Shaykh is going to check back in and see if there are any questions for him there and try his very best to answer those for you if he misses them today. I will give you 2 questions, and you can address those, and if you'll please close with a beautiful dua for us, we really appreciate it, Shaykh. One is, what is it permissible to do in terms of affection with our wives during the fasting that will not invalidate it? The second question is, can we smell incense? Can we burn oud? Can we smell smells while we're fasting without it invalidating it? Can we bathe? And, in general, these are the last of the questions. Jazakallahu khairan, Shaykh, and we love to have you back again.
When it comes to the incense and the oud and things like that, or the bukhur that we burn in the house, it's permissible to burn them. There's no problem with that. However, like coming and inhaling them and smelling them, that is an issue. We need to stay away, obviously, from that. But when it comes to just burning in the house in general, even if a little bit were to come and to have an impact on us, then that would be something that it doesn't have any effect on the fast. It doesn't invalidate the fast in any way. And so if you're walking by the incense or by the bukhur or the oud that's burning, and somewhere even to come into your nose as you're walking by it, there's no problem with that. Well, obviously, you just can't come over and inhale it and sniff it in. Obviously, that's something that's not permissible. Regarding the relations with our spouses, the Prophet ﷺ, he used to kiss his wives when he was fasting. But as Aisha radiallahu ta'ala anha said, that he was the one who could control himself more. He had the ability to control himself or to control his desires. Therefore, many of the scholars said that it is makruh, it's disliked to have any type of relations with the wife, because obviously you don't know where that could lead for you or for her. So it's better to avoid them during the fast, inshallah ta'ala. Alhamdulillah, we have the night times where we can make up for that. So it's better that we stay away from it in the daytime. But in a basic a kiss, and especially if it's your custom to follow the sunnah, to kiss your wife maybe when you enter into the house or something like that, then that is permissible, but it's better to stay away from it. Especially, it could even be haram for some people. If somebody knows that he has a very strong desire or sexual desire, and that would excite him and maybe lead him to fall into that which is haram, then obviously he must avoid that. But in general, it's better to stay away from it, inshallah ta'ala, just so we don't fall into anything that would invalidate our fast. Barakallahu feek.
Okay, Shaykh, the other question was about bathing, if you're allowed to bathe in Ramadan, and then also vaccines, and that's our last questions, and then we'll excuse you.
Yeah, the vaccines is the same ruling. If there's nothing nourishing in the vaccination or in the shot, then it doesn't have an effect, inshallah ta'ala, on the fast. When it comes to bathing, no problem whatsoever, and even swimming, which people don't realize, because this is actually the exercise that I'm doing these days here in Malaysia, is that I'm swimming with my kids during Ramadan. And somebody asked me, "Oh, you're fasting. How can you swim?" I said, "Alhamdulillah, there's no problem with swimming." And this is the scholars mentioned this, and even Shaykh al-Uthaymeen, he said that actually it could be something good for fasting, because it can give you energy as you're fasting. But obviously, you have to be very careful that when you go underwater, that you don't, because we know the water, if it goes to the nose, that can break the fast, and also if it goes into the mouth. And any water that goes into the mouth, all you have to do is just spit it out. If you're bathing or swimming, there's no problem with that, inshallah ta'ala. Many of the questions are coming on the chat. They were mentioned in the 42 points that we mentioned. So they can go back to the recording, inshallah ta'ala, and hear all those, inshallah ta'ala.
Jazakallahu khairan. Shaykh, we won't keep you any longer. We really appreciate all of your efforts and sharing all of this beautiful knowledge with us today. May Allah subhanahu wa ta'ala bless you. You know that we always love to have you on the webinar. Hopefully we can have you back on again for another very beneficial topic. And if you'll just close with dua for all of us, we would certainly appreciate it. And may Allah subhanahu wa ta'ala bless you and your family out in Malaysia with the best Ramadan ever, accepted good deeds, and increase in iman and your understanding and your yaqeen. Ya Allah Rabbul Alameen.
Ask Allah subhanahu wa ta'ala to bless all of us and to make us from those who fast Ramadan imanan wa ihtisaban, and from those who fast Ramadan and have their sins forgiven, and those who are successful in making the qiyam of Ramadan. May Allah subhanahu wa ta'ala make us from all of those who are free from the hellfire in this blessed month, and may Allah subhanahu wa ta'ala make us from those who establish and obtain the taqwa during this blessed month and continue after Ramadan. Barakallahu feekum.
Jazakallahu khairan to everybody who attended. Please see us back on our next very exciting Ramadan retreat lecture. Jazakallahu khairan for attending, and Ramadan Mubarak to all. Assalamu alaikum wa rahmatullahi wa barakatuh.